Everyone, welcome to today's webinar short. We're talking about the Medicare rules for therapy plans of care. My name is Zachary Edgar, and my company is called Therapy Comply. Therapy Comply is a membership-based compliance, education, and consulting firm specifically for physical, occupational, and speech therapy practices. We offer full-length continuing education courses, guides, and sample forms for Medicare, TRICARE, HIPAA, NCCI, OSHA, and other important compliance issues. We're working on bringing you all 50 states that will include PT, OT, SLP compliance guides and policies, Medicaid, workers' comp, pediatric services, home health, medical records, liens, waste, fraud, and abuse. And we also provide ongoing and comprehensive support for our members. Disclaimer, this presentation is for informational purposes only. None of the material is intended as legal advice. All right, to start, establishing the plan of care. Therapy services must relate directly and specifically to a written treatment plan. The plan must be established before treatment has begun, and the plan is established when it's developed, either written or dictated. So in outpatient therapy services, the plan of care must be established either by a physician or NPP in consultation with a treating PT, OT, or SLP. And if it is a core for comprehensive outpatient rehab facility, then only a physician can establish a plan of care, and NPPs such as a nurse practitioner, or physician or assistant cannot establish a plan, but of course a PT, OT, or SLP can establish care. And of course, for other outpatient therapy services, a PT for PT services, OT for OT services, SLP for speech language pathology services. In treatment under the plan, the evaluation and treatment may occur and are both billable either on the same day or at subsequent visits. It is appropriate that treatment begins when a plan is established. Therapy may be initiated by qualified personnel based on a dictated plan, and treatment may be begun before the plan is committed to writing only if the treatment is performed or supervised by the clinician who establishes the plan. So under Medicare rules and many other payers, you can bill for an evaluation and treatment on the same day. Contents, plan of care must contain goals, the type of therapy, the amount, frequency, and duration. The goals, so it's important to have, of course, you are required to have long-term goals, and they must pertain to the functional impairment findings documented in the evaluation, reflect the final level the patient is expected to achieve as a result of therapy in that current setting. They need to be realistic and should have a positive effect on the quality of the patient's everyday functions, and be function-based and written in objective, measurable terms with a predicted date for achieving the goals. Long-term treatment goals should be developed for the entire episode of care in that current setting. When the episode is anticipated to be long enough to require more than one certification, so that's after 90 days, the long-term goals may be specific to the part of the episode that is being certified, and goals should be measurable and pertain to the identified functional impairments. Short-term goals can also be established. These goals for a week or a month of therapy to help track the progress towards the goal for the episode of care. If the expected episode of care is short, for example, therapy is expected to be completed within 4 to 6 treatment days, the long-term and short-term goals may be the same. You're not required to have short-term goals in your plan of care, but you are required to have long-term goals. This is the type of treatment, includes the type of therapy discipline operating under the plan of care, so the PT, OT, or SLP plan, and should describe the types of treatments such as modalities, procedures, or other interventions that are going to be provided. Changing procedures and modalities during the episode of care is allowed. You can do that without having the plan recertified. But if you want to change the long-term goals, you do need a recertification. We'll talk about that a little later. Also, you must specify if rehab therapy or maintenance therapy is going to be provided to the patient. Rehabilitative therapy. This includes services designed to address recovery or improvement in function and, when possible, restoration to a previous level of health and well-being. Improvement is evidenced by successive objective measurements whenever possible. If an individual's expected rehabilitation potential is insignificant in relation to the extent and duration of therapy services required to achieve such potential, rehab therapy is not reasonable and necessary. Maintenance therapy. The goals of a maintenance program would be to maintain functional status or to prevent or slow further deterioration in function. Such skilled care is necessary for the performance of safe and effective maintenance program only when the therapy procedures required to maintain the patient's current function or to prevent or slow further deterioration are of such complexity and sophistication that the skills of a qualified therapist are required to furnish the therapy procedure, or the particular patient's special medical complications require the skills of a qualified therapist to furnish a therapy service required to maintain the patient's current function or to prevent or slow further deterioration, even if the skills of a therapist are not ordinarily needed to perform such procedures. So, depending on the patient's condition, you may need a maintenance plan and you may need to have therapy services provided by a therapist if it would be too dangerous for the patient to do them on their own or with a caregiver. But once you've done a certain amount of maintenance therapy and the patient, you can determine the patient, it's safe for the patient to do the therapeutic exercises on their own or under the care of a caregiver, then the patient should be discharged. The amount. This refers to the number of times in a day the type of treatment will be provided. Where not specified, one treatment session a day is going to be assumed. Treatment provided more than one session per day per discipline will require additional documentation to support that amount of therapy. The frequency, this refers to the number of times in a week that the type of treatment is provided. Treatment more than two times a week is expected to be a rare occurrence. Treatment frequency greater than 3 times per week requires extra documentation to support that intensity. That means your documentation should explain exactly why the patient needs 3 or more treatment days per week. Frequency refers to the number of times in a week that the type of treatment is provided. Where frequency is not specified, one treatment is assumed. The duration, this is the number of weeks or the number of treatment sessions for the plan of care. If the episode of care is anticipated to extend beyond the 90 calendar day limit for certification of the plan, it's desirable, although not required, that the clinician also estimate the duration of the entire episode of care in the setting. Refer to the number of weeks or the number of treatment sessions on the plan of care, and clinicians should also estimate the duration of the entire episode of care in that setting. 2 plans. It's acceptable to treat under 2 separate plans of care when different physicians or MPPs refer a patient for different conditions. It's also acceptable to combine the plans of care into one plan covering both conditions if one or the other referring physician or MPP is willing to certify the plan for both conditions. Progress reports should be combined if it is possible to make clear that the goals for each plan are being addressed. 2 different therapy disciplines, so there must be 2 different plans of care for each type of therapy discipline. So if you have a patient that needs both physical therapy and occupational therapy, you do need to have different plans of care to address each. When more than one discipline is treating a patient, you must establish a diagnosis goals independently. The form of the plan and the number of plans incorporated into one document are not limited as long as the required information is present and related to each discipline separately. For example, a physical therapist may not provide services under an occupational therapist plan of care, but they can do under their own plans of care. Both may be treating the patient for the same condition at different times in the same day for goals consistent within their own scopes of practice. Changes to the plan. So over the time, the plan of care can change. Physician certification of changes to a plan of care are only required when there is a significant change. Significant change here means when there's changes to the long-term goals, there's been a significant change in the patient's condition that requires changes in those goals, then that plan of care needs to be recertified as soon as possible by the physician. Insignificant changes, these are going to be changes in frequency or duration to the patient's illness or modification of the short-term goals to adjust for improvements made towards the same long-term goals. Also, changes to procedures or modalities also do not require a physician's signature when they represent adjustments to the plan that result from the normal progression in the patient's disease or condition, or adjustments due to lack of expected response to planned intervention. So as long as you're not changing the long-term goals, you don't need to have recertification of the plan of care. Certification and recertification. When the physician or NPP signs and dates the plan of care, they certify that therapy services are required for the patient, that the plan of care has been established and reviewed by that physician or NPP, and the services are or were furnished while the individual is or was under the care of that physician. Certifications are required for each interval of treatment based on the patient's need, not to exceed 90 calendar days from the initial therapy treatment date. Timely certification of the initial plan is met when the physician uh, certifies a plan of care and it's documented by a signature or verbal order and dated in 30 days following the first day of treatment. Who? It needs to be a physician or MPP who is treating the patient. Physician with respect to outpatient rehab therapy services means a doctor of medicine, osteopathy, pediatric medicine, or optometry if those rehab relate to those specific areas of medicine. So if a podiatrist signs off on a plan of care, that therapy has to relate to the foot. Optometrist means low-level vision rehab only. And the NPP means physician assistants, clinical nurse specialists, nurse practitioners, and that's if the state or local laws permit that. Chiropractors and dentists or dental medicine are not considered physicians for therapy services and may neither refer patients for rehab therapy services nor establish therapy plans of care. Many states do allow chiropractors to refer to physical and occupational therapy services, but under Medicare, a chiropractor cannot sign off on a therapy plan of care, no matter what the state law says. Verbal certification is allowed. If the order to certify is verbal, it must be followed within 14 days by signature to be timely. A dated notation of the order to certify the plan should be made in the patient's medical record. The format, acceptable documentation and certification, maybe, for example, a physician's progress note, a physician's NPP order, or a plan of care that is signed and dated by the physician and indicates the physician is aware that therapy service is or was in progress, and the physician makes no record of disagreement with the plan when there's evidence of the plan was sent or available in the record for the physician to review. The best form to do this is on the plan of care itself, is to have the physician or MPP sign and date the plan of care. You should have that right by where the therapist signs and dates the plan of care. Have that either done electronically or in writing, but that's the best format. Referring to a physician order, something like that, or something down the line, like a note, that can mess up your documentation. You really want to have that physician signature on the plan of care. Delayed certifications are acceptable. Delayed certification and recertification requirements shall be deemed satisfied where at any later date a physician or MPP makes a certification accompanied by a reason for the delay. They should include any evidence the provider or supplier considers necessary to justify the delay. For example, a certification may be delayed because the physician did not sign it or the original was lost. In case of a long delayed certification over 6 months, the provider or supplier may choose to submit with the delayed certification some documentation, either an order, a progress note, telephone contact, request for certification, or signed statement by the NPP indicating the need for care and that the patient was under the care of the physician at the time. So any evidence that can show the physician was aware therapy services were being provided to the patient and agreed on them. Recertification. Recertification that document the need for continued or modified therapy plan should be signed whenever the need for a significant modification of the plan becomes evident. Like I said, changes to long-term goals, or at least every 90 days after the initiation of treatment of that plan of care, unless there's a delay. And also very important here, reevaluation is not a recertification. Medicare does not cover periodic reevaluations. A reevaluation should only be done if there's been a significant change in the patient's condition that warrants it. And then once that's done and you wish to change the long-term goals or whatever needs to be changed, you're going to have that recertified. But if you're doing a periodic recertification, for example, every 90 days, you're not going to do an evaluation with that recertification. You're just going to get that plan of care re-signed by the physician or NPP. All right. Thank you all for joining me today. Please visit us at www.therapycomply.com for more information on Medicare, TRICARE, and everything else therapy related. Thank you.